Happy Saturday and welcome back to the place where we put your well-being first. And of course, being October, it is Breast Cancer Awareness Month. We have still got a few days left. So of course, we're raising awareness for breast cancer, early checks and seeing those signs and symptoms, because early checks, any irregularities can be treated early. Now, breast cancer is one of the biggest cancers in the world and obviously is female dominant, but it doesn't mean it's just only females that can get it. So this video, whether you are male or female, is for you because we all need to be aware of our bodies. So breast cancer basically is a type of cancer that affects, say, this area. If I could draw a pen, okay, so obviously collarbones, underarms, and all things like that. So obviously your body is not just breasts as themselves, it is surrounding tissues, nodes, and things like this. Okay, so it is men and women. It is not specific to any age or global location or anything like that. It can basically hit anyone. It's also not only hereditary. So we can't say, oh, because you've had it in your family. That can increase the risk, but it doesn't mean it can only be located there. Okay. So breast cancer can start in different areas of the breast, and it obviously can spread to other parts of the body. Like any cancer, it can spread. So if it's not detected and treated early, then of course we can have a much bigger problem. Okay. So the risk of breast cancer actually does develop with age. So as we get older, it becomes higher. So obviously it becomes much more common by the time we hit our sort of mid 40s and of course 50s. Okay. But of course, young women can develop breast cancer as well. Okay. And when I was in a hospital with having my nose surgery, I was actually next door to a young lady who was actually having a lump removed from her breast. So I don't know whether it was cancer or anything. They think it was benign, but I was in a bed next to a young lady and she was about 20. So it can really happen to anyone. Okay. So like I said, family history, hereditary can be a factor, but it doesn't limit it. But things like being overweight, obese, obviously high levels of estrogen. So that's actually why it tends to be more female dominant, because of the levels of estrogen in our bodies. Okay. But not all breast lumps are cancerous. Remember, I said the young lady, obviously lumps can just be benign and they can be nothing, okay? But they're always worth getting checked. That's the important message, because you don't know. And in fact, something that's benign could become something cancerous if left unchecked, okay? So that's why we want to make sure we get the health care support that we need. Okay, so things that can happen. So what is it? It's basically a lump or thickening of the breast or underarm area. So remember our sort of area. So a change in the size or shape of the breast, nipple discoloration or retraction, skin changes. Let me check my notes. Breast pain or tenderness, and of course, remember that not all changes are about things. Sometimes it can just be just a change in your body. It can be maybe another infection or something else. But if you notice there is something that is different and there is a change, so like redness, like and all those sort of lumps, all this sorts of thing, then of course it is worth getting checked out. Okay, so that's why we need to check our bodies on a regular basis. Okay, so self-examination, can I get more words up? Self-examination is a simple way to check yourself. Okay, so obviously we're recommended that obviously women, you obviously do it arm up, check, and obviously all this. And preferably, ladies, if we do this a few days after our period, that's actually the best sort of time in our month or our monthly cycle to do it. So of course, obviously, if you notice any changes, any lumps, and of course contact your healthcare provider, GP, if UK 111 or direct GP, whichever works better. Okay, and of course, important to have regular checkups. But of course, your partner can do this for you. And I don't just mean when you're having fun yourselves, I mean actually checking your bodies. Okay, there is a slight difference between what you notice, although your partner may be able to notice for you. Okay, so again, be aware of it. It's not just you, it's both of you. Okay, but of course, obviously during your checkup, if you go to a healthcare provider, they will perform a clinical breast exam, okay, which involves feeling under your breasts, underarms for any lumps or changes, okay? So be prepared to have somebody look at the whole area, because remember, it can affect the whole area, okay? And it also may result in a mammogram, okay? So that's an x-ray of the breast tissue and get my words out. Okay, so of course it is important for us to check early, because then if it does become, we go for a clinical check and all this, it can get picked up very quickly and be isolated into a small spot. And of course, if we isolate into a small area, treatment is much more effective or much easier. Okay, and of course, obviously, we want to make sure we do this on a regular basis. Okay, just to reinforce that. Okay, so women at high risk may need to start screening earlier or have more frequent checks. Okay, so if you know you're high risk, maybe your mum, your grandma, you've got relatives who have had it, father, like I said, it's not just gender specific, but if you know there's potentially a higher risk for you, then get checked more often. Okay, try to, maybe ladies, once a month, guys, follow suit, if we can get into that sort of habit, rather than waiting once every 12 months or whatever it is. But actually it's worth doing. Okay, because remember, it can creep up without us realizing, and of course that early detection is key. I cannot stress that enough. Okay, so obviously we have those x-rays, the mammograms, okay, which obviously check for changes, and they obviously is a safe and effective tool that they use for breast cancer screening. Okay, so obviously the women at an average risk, so if you're on an average risk, then it's recommended you have a mammogram every 2 years between the ages of 50 and 74. Okay, so if you're maybe a bit older, maybe you've not seen anything, maybe you want to speak to your GP or healthcare professional and see about getting some mammogram done for yourself. Okay, or at least seek their advice. Okay, it's no harm, because we all go to the GP at some point for a checkup or something. Then of course it's worth doing. Okay, but obviously if you are high risk, then of course you probably have to have them more frequently. Okay, but of course, like I say, that early detection is obviously much more likely to have a successful treatment. Okay, so we want to prolong life, we want to save life, so of course we need to catch things early. Okay, so that's the importance of it. So obviously, if we catching it early, there are several treatment options available. Okay, so obviously the different treatments that you can have will depend on your type and stage of breast cancer. Okay, as well as your overall health. So it's not just a one size fits all, it's what is going to be the best option for you. So it may be like the young lady next to me who had that small lump tumor removed. Okay, maybe benign, but it was removed from her body nice and easy. Okay, then of course there actually was a lady opposite me who was older, who had it removed and then also had the opposite done, because she had one breast completely removed then repaired, so she was having loads of different work done, right? Okay, but there are a lot of women out there who are having this work. Okay, but also radiotherapy. Okay, so when I went to the Isle of Wight last, on the ferry back, I actually sat down next to a lady. I was talking to her, she was really lovely, but she was going for her radiotherapy. Okay, so she's got cancer, she was having treatment. So there are a lot of people you may find like that. They may be wearing scarves around their head, and all this sorts of thing. So you may find them, particularly when they know they've got these radio therapy sessions. Okay, you may find them across some public transport and things like this. Okay, and of course you can have chemotherapy, hormone replacement, targeted therapy, or of course a combination. It depends on you, your stage, your type, and your health. So that's why it's important. That's why this month, where we're encouraging to move our bodies, to actually engage in these squats, it's actually us trying to keep our weight down, our bodies healthier. So if something does happen, we're in a much better state to face it. But also, it can actually reduce risks of serious conditions. Okay, so obviously we want to make sure that we get these regular checks by ourselves, and of course our healthcare provider. So of course, ladies, if you're having smear tests going every 3 years, do you want to throw that in? Maybe ask your nurse for advice. Okay, whoever does it. Okay, but of course, to wrap it up, guys, breast cancer, I can talk all day and go on and on about the same things, but I think you're getting the point. Breast cancer is a big thing. Okay, I think it's the third biggest cancer in the world, and it's the second biggest within women. Okay, for deaths. Now, for something that big, for us not to be checking our bodies is huge. Okay, and it's just a simple thing like actually just checking your body. I know that sounds really crazy. Arm up, underneath, checking all around, noticing any lumps, discolorations, or anything like that. But of course, it's not just about you. It's about those that you love that are in your life, but also supporting the needed charities. So breast cancer research, okay? That's why October is so crucial. Okay, so if you are joining for the 20 squats a day challenge for 30 days, this is day 21. Okay, drop in the comments and let me know how you're doing, because we've had Sean, Paul, Annie. I know you've all been along for the challenge, and of course I know there's others as well, but let me know. Let's shout about this, let's celebrate it, but also let's keep raising awareness. So encouragement for us to keep going, but also for others to keep looking after our bodies, to stay on point, and of course support the charities as well. The link is going to go below, so if you want to make a donation. All right, otherwise I hope you found some use in this video. Do hit that like if you found it useful, and of course new meditation will drop on Monday. I do hope you enjoy it. Otherwise, have a beautiful and amazing weekend. Thank you.